Even as the rate of new COVID cases are down in Georgia, the death rate is still high. 190 people died from COVID in just the last 24 hours.
The strain on hospital staff has been enormous, and there are still so many people fighting this virus. Caitlin Ross spoke to a woman trying to support them all through ministry. Caitlin, what do you have for us this evening?
Dorie Griggs attends all of the deaths on every floor when patients want her there at Emory St. Joseph's Hospital. She is the chaplain for the hospital and says with how isolated people have been through the COVID-19 pandemic, chaplaincy is needed more now than ever.
Chaplain Dorie Griggs starts each shift at Emory St. Joseph's Hospital with a simple prayer.
You just hope that you'll be present in a way that'll help other people.
She started working at the hospital in the middle of the COVID pandemic and supported hundreds of families through the virus.
You just say a little prayer and hope God will use you in the way that will help.
She says chaplains are needed more than ever in hospitals that have been overrun by COVID cases for 2 years. She's not just there to see the patients, but the doctors and nurses working there as well.
We all have our own faith, but we don't advance that on other people. We're here to listen.
And she says a lot of times that's all people need, someone to be there to listen.
When I first started, we had no visitors at all. The chaplain stood in that gap for the patient and the families.
In January of last year, she stood at the bedside of 6 different patients who died of COVID-19 in just one shift. She says no matter how much experience you have, it still feels heavy.
I've learned to stay on the floor a little bit longer after a death and if you're just present and you have chaplain on your name badge, people just start talking to you.
Even as case numbers drop in the community, hospitals are still dealing with an onslaught of COVID patients every day. And she says it can be hard for everyone who works there to cope.
Nurses are trained to fix things. Nurses and doctors, all the medical, the techs, everyone is here to help people feel better. Chaplains stand in that gap. A lot of times, no, we can't make anything better. There's nothing we can say or do to make a situation better, but we can help people feel like they're not alone.
She says for people struggling with grief or loss, that's the most important thing, to make sure people know that they're not alone. She told me the worst thing you can say to someone struggling is nothing at all.